Well, hello there. This is Dr. Brian McKay from Neuropathy at CoreHealth. And today I would like to discuss with you CIPN, chemotherapy-induced peripheral neuropathy. It's one of those complications. I mean, we're glad to get rid of cancer, myself included, but you do have the risk of damage to the nerves. You have to understand the toxic, chemotherapy, the chemotoxic agents can eat away the covering on the nerve. This presents as, loss of balance, numbness, tingling, pain in the feet, primarily the feet, but it can also hit the hands. But the feet seem to be get the lion's share of the stuff. So CIPN is, you know what. Let's first though, what can you do to deal with it? Always got to talk to your doctor about this stuff. We have a natural treatment, so but you still need to have your doctor on board with this. The pain medications they want, I mean, you're already taking enough medications as it is. Question is, how many can you really, do you need more? I mean, if you're taking 2, 3, 4 medications, you're going to be taking 5 or 6 medications. So, this is some common sense things to do, okay? Find out what makes your CIPN or your chemo-induced peripheral neuropathy worse. Is it hot or cold temperatures or snug clothes, tight-fitting clothes or shoes? And avoid them. I mean, it's just common sense. Give yourself extra time to do things. If you have certain tasks like going up on a ladder or, cleaning out a closet, again, you're up on a step stool, ask friends to help or ask someone else to do it for you. It really, you definitely want to, you want to be as safe as possible. This is a tough one. Don't drink alcohol. It can make your symptoms of CIPN worse. It can cause nerve damage on its own as well. So alcohol is not going to help you. And if you have diabetes, alcohol is clearly not going to help. If you have high blood pressure or high levels of blood sugar, again, alcohol is not going to help. The other thing too is drink plenty of water, fruits and vegetable whole grains to get enough fiber. And this is one that I really take issue with, but it's kind of some people recommend if neuropathy is in your feet, you sit down as much as possible. Like even when you're brushing teeth or cooking. That's not going to solve anything because you really start to limit the blood flow to that area and you want to increase and stimulate blood flow to that area. So my advice to you is stand and walk as much as possible. But that's where we kind of come in here. Now, I do this podcast as a way of educating people. And, I can only educate you as to what I know. And to that end, I want to talk about a therapy that we employ here, and we call electroceutical medicine. And what it comes out is there's a machine that's made in Germany that produces certain effects, and what we have found is particularly that we are able to help people with neuropathy. It's a German company called Hacomed, and they've been producing this machine for many years because I'm actually on my second machine right now. And they've kind of pioneered this field of electroceutical medicine. And it's a type of electric muscle stimulation, but it's a whole much higher level of effectiveness. I mean, first of all, you can buy a TENS unit for, $200, even less. If you use the one Shaq, recommends people use. But in our case, this machine was $40,000, the newer one. And the way you have to think about it is communication between the cells take place in two ways, bioelectrically and biochemically. And it happens all across the whole body. So it's all electrical, currents and chemical messages communicating efficiently, which then leads up to a nerve impulse going to if it comes from your feet, it goes to the dorsal root ganglion in the spine. And then it goes up to the brain through the spinal cord. But it's cellular communication. So what this particular therapy does is it allows both bioelectrical and biochemical communication to be enhanced at the same time. Okay? So when that happens, the whole body becomes more efficient. Okay? So we get the body to really become a much more efficient machine. using this HacoMed, I call it the HacoMed matrix for really making a difference in people's lives, and we're seeing it because it's not another medication. The last thing you need, I get, is another medication. Certain medications you have to be on for life. Now, I'm looking at a study in Frontiers in Neuroscience where you know the relationship between exercise, sensory nerves, and neuropathic pain. Um, this goes back to 2016, end of August. What basically is, I think exercise is going to help everything. I mean, every single disease process is going to help with exercise. Well, let's stop. Maybe if you have a trauma, you blow your shoulder out as a pitcher. Well, you're not going to continue pitching on that shoulder, but at some point you have to rehab it. But physical activities is the way to go. And one of the things that we use here at Neuropathy CoreHealth is really it's exercise, but it's passive and it's external. Someone's in really bad shape. If some of the gurus are saying, sit down when you brush your teeth, sit down when you're cutting up food. We're sitting down way too much. I'm sure by now you've heard the term, smoking sitting is the new smoking, and especially this day and age where I'm sure we're all sitting down a whole lot more, a whole lot more. So, so we use a type of a machine. It's called whole body vibration. Now, I didn't invent it. It got its start with the Russian space program. They found by sending the cosmonauts up into outer space, they needed to have, they needed to have some kind of exercise, but you weren't going to send up a life cycle or elliptical into space. Quite honestly, I don't know if they even had ellipticals back then when Soyuz was going up into outer space. But what were they? So the exercise is important. So the whole body vibration passively exercises the body for you. It gets blood flow going, which we want in all cases. One of the treatments that we use here with great amount of success is we have patients where we apply near infrared light therapy to stimulate production of nitric oxide on the affected body part, and that's a pretty impressive way. What happens is, nitric oxide vasodilates, so it opens up the blood vessels and allows for greater blood flow. And when you have someone who's in a disease state, especially like chemotherapy, because you have the underlying cancer, then you get the trauma. That's a trauma, the damage to the covering on the nerve, making it worse. You have to consider all these things. It's a comorbidity. So when you have this comorbidity, we have to address it. So the near infrared light therapy stimulates production. The body produces NO2, nitric oxide. It just does less in a disease state or as we age. Most people with chemotherapy induced peripheral neuropathy or diabetic neuropathy are going to be older in age. It's just the population that we see. And I think it makes sense. The body just doesn't hold up as well as it did when we're in our 20s, 30s, and 40s. So you're in 50s, 60s, and 70s, and you get knocked by this stuff. So the near infrared light therapy will stimulate blood flow on the localized level. We use laser, cold laser. The new term for cold laser is photobiomodulation. I don't like that term. It's too long. I always say if you're going to be on Jeopardy, you might want to remember it. But the laser stimulates production on the localized level of ATP, which is adenosine triphosphate. Adenosine triphosphate is an energy source for the body. Think of them for the mitochondria. Mitochondria produce, the mitochondria working properly. It uses light energy to produce adenosine triphosphate. So you really have something going on that can make again, big difference in a chemo-induced peripheral neuropathy. Listen, I'm not opposed to medication, but I think, I just think it's overdone. Do you really need a fourth, fifth, sixth medication when you have X, Y, and Z already going on? I tend to think not. But for the people who have this, this chemotherapy stuff, you definitely want to avoid injury. I think that makes sense. But you kind of want to do something about it. Not everybody treats neuropathy. I know there's, if you go on the internet, you're going to find tons of stuff. And a lot of times the doctors who treat your cancer really get their hands up in the air because there's not much more that they can really do for you. They're happy to take care of your cancer and they do a good job, but when you come to a facility like Neuropathy or CoreHealth, we're going to take a look at you on a different level. We're not going to change your medication. We can't. It's wrong. Your medication is what your doctor puts you on. You follow it. We are going to come up with a nutritional protocol. I think it's a pretty simple nutritional protocol, but a very encompassing one because, one, we have a really good multivitamin. We have a B complex that, again, helps with vasodilation, which opens up the blood flow. And then we have 2 specific nerve supplements that aid in healing the nerve. So it comes back about healing. I don't think we're ever going to say we cure peripheral neuropathy. We just make the situation a whole lot better. And we've been doing so for a couple of years now with a lot of great success. So this really wasn't meant to be a sales pitch. It was meant to be more educational. I got to be honest with you, some of the treatment's covered by Medicare and some is not. It just comes down to it. Medicare does not cover everything. So, I mean, the physical therapy parts, the more traditional parts that they're going to cover, some they won't. But if you're interested, you definitely give us a call. I mean, our number is 203-875-0846, 203-875-0846. And let's see what we can do to make your life a little bit better. Chemo-induced peripheral neuropathy is not going to go away. Pretty much 30-40% of people who go through chemo will get it. Question is, can we help you? We don't know unless we do an exam. You probably pretty much could come in and tell us you have it, but we have to see the severity because there are some cases we can help, and the exam is really to tell us if we cannot help you because we would never waste your time. That's precious as it is. So I'm Dr. Brian McKay from Neuropathy at CoreHealth. I look forward to hearing from you. If you got a question, I have an ebook out there. Give us a call, 203-875-0846, 203-875-0846. Thanks a lot. Have a great day.